Hey there, can I ask you a question? Do you feel like there's more you can be doing to help your dog with their mobility, help them move better and feel better? Maybe they're getting older and they're slowing down, or they're recovering from an injury, or they're post operative, or maybe you even have a dog that has paralysis and you're wondering how to take care of them. And you're getting tired or frustrated with that list of things they can't do and wondering, what else can I be doing to help my dog get back on their feet again? Welcome to the first ever episode of Dogs That Can, the podcast. I'm Sarah MacKeigan, your host. Thank you so much for being here. I'm a canine rehab therapist, physiotherapist, creator of an online community called Living with Dogs with Disabilities. And most of all, I'm an inspired dog mom. This podcast is all about what you can do to help your dog lead a long, active life despite injury or illness. In this very first episode, we're going to be talking about approaches to injury recovery and why that traditional approach of rest and anti-inflammatories may not be getting you the results that you're looking for. But before we go there, first, why Dogs That Can? And who am I and why should you listen to me? If you're listening right now, you're probably looking for something to help your dog. You're probably in search of some answers to help them with their mobility, whether they have a knee injury or maybe they've hurt their back. Maybe you're trying to decide whether or not they need surgery and have a very small window of time to do that in. Or maybe they've just slowed down a little bit and you're looking for some help with their mobility that way. You might be feeling a little bit isolated. You're probably feeling overwhelmed with the amount of information that is online. And I'm here to say, yes, the struggle is real, but it doesn't have to be quite so hard. My own dog, Sammy, was my heart dog, and she was the dog that introduced me. She's basically the reason we're having this conversation right now. She was a German Shepherd and was running through the woods with my golden retriever, Reggie, and she yelped. She came out of the woods and she was on three legs. I was thinking, put it down. You're okay. You can put it down. And she didn't. And I soon realized this was a little bit more serious. And I was like, I don't even know how to get her back to the car at this point. And this guy was walking up the hill with his dog. And he literally picked up my dog, put her over his shoulders, this big white German Shepherd that couldn't weight bear on her back leg. And I took Reggie and we walked back to the car. And long story short, she had torn ligaments in her knee, cruciate injury. When I was rehabbing her, there was a physiotherapist that was mentoring the vet that I was bringing her to. And I discovered that physiotherapists could do canine rehab. Sam's story doesn't end there, though. And when I say the struggle is real, I get it because Sam actually had a condition later in life that showed up that's called degenerative myelopathy. And if you know anything about DM, well, it sucks. Let's start with that. But it's a neurodegenerative disease. Sammy lived almost 5 years with DM. It's progressive. It's analogous with about 20% of ALS cases. And the lifespan of a dog with DM, degenerative myelopathy, is generally quite short, usually under a year. I attributed to a few things. She had a great diet. She was strong because we had done all this rehab when she hurt her knees. And also because we had really amazing supports in place. I had access to people that knew more than I did that could help us along this journey. And that's what I'm hoping to give you a little bit of in this podcast is to raise your awareness of what is possible, what you can do, and to help when you need to access these people or resources or mobility aids that you know where to go and what you need to get. Sam's story doesn't end there. She passed away right at the beginning of COVID in 2020. And that was extremely difficult for obvious reasons. And I saw at the same time, while I was grieving, a lot of people online struggling. The vet system was struggling. People were struggling with, what do I do with my dog? And there was all of this misinformation out there. And of course, everybody has their opinion on what you should be doing. And I really wanted to do something. And that's when I created a community called Living with Dogs with Disabilities on Facebook. I'd love it if you came and joined us there as well. It's all about what you can do to support your dog, bringing in experts from around the globe, literally around the globe, and also sharing inspiring stories from other pet parents. And really, Dogs That Can is an evolution of living with dogs with disabilities. It's taking it one step farther and bringing that information to a place where more people can access it. So, thank you again for being here and being part of this really important movement and part of Sam's story. And I hope you get a lot out of this podcast. So, we are going to talk a little bit more about the 4 approaches to injury recovery. Before we jump in, mention this is episode 1, which is very exciting for me. It's also a little bit scary. And I've done lots of live streams and lots of interviews. Podcasting is a totally different beast. I thought I was just going to take some of the content that I had on Facebook, repurpose it to here, show up, record, and share with you. And that's part of it. But there's a lot more to it. So I'm learning as I go. I would love to know in the comments what you think. But go easy on me at the same time because I'm learning as I go. So without further ado, let's talk first about meds and rest and medication. Absolutely necessary when your dog has pain. Never saying that it isn't. And just as a little disclaimer here, this podcast is educational. It doesn't replace veterinary medicine. If your dog needs veterinary medicine, please go to your vet. Back to rest and medication. We're going to look at 2 examples as we go through this and talk about why you might not be getting the results that you're looking for if this is your approach. And let's start with the knee injury. Let's go back to Sam running through the woods. And let's say she comes out, she's on 3 legs. I take her to the vet. They do some tests. I decide I don't want to do x-rays right away. It's okay, well, let's put her on some anti-inflammatories. Don't do anything with her for the next 2 weeks and see if it improves. And if it doesn't, come back and see me. You've probably had this experience. And maybe they didn't find a whole lot clinically when they tested her. Maybe she's a little sore in her groin or something like that, but not a whole lot. So I go back. She goes home. Yes, resting her is a pain. It's difficult to do, but she gets better. She's weight bearing. She looks pretty good. So I start to walk her on leash and things are going fine. Take her back to the dog park, let her run with Reggie. And she pulls up on 3 legs again. What? Why? Right? So I take her back to the vet. And maybe this time they opt to say, you know what? We're not finding a whole lot, but maybe we should do some x-rays, make sure she hasn't hurt her knee and there's nothing going on there. And remember, this is scenario 1. So we're going to talk about two scenarios. So we go back and again, they do the x-rays. Let's the x-rays come up totally clean. And just as a quick side note, if you're getting x-rays for your dogs, 2 quick tips or 2 things. Do both sides so that you know what your baseline is for your dog. The other thing is soft tissue injuries do not show up in x-rays. So let's say Sam's x-rays came back totally fine. There was no swelling in the knee. What's going on? Maybe it's a soft tissue injury. Okay. So we go back and try this rest and medication again, slower start to going back to activity. Long story short, she ends up on 3 legs again. And I'm like, what do I do? How do I help my dog? I did a live stream on soft tissue injuries and anti-inflammatories. I'll share it in the resources. It really explains this well. But 10 my fingers, if I web my fingers together, are the muscle fibers. And then when they're injured, they get these little micro tears in the muscle fibers. If you're resting and you're just putting your dog on medication, then you're going to get scarred tissue around those muscle fibers as the tissue begins to heal. And then what that happens is they're not as strong. They don't have the same components, the same amount of movement and give and strength as the rest of the muscle fibers. So as soon as you let your dog run again and they have all that force going through those tissues, they tear them again, and maybe they tear a little bit more. And then they heal kind of all jumbled up, scarred tissue, kind of like a spider web almost. But if you went through a slow, progressive exercise at an appropriate stage of healing, Then we help to put a bit of force through those jumbled up muscle fibers and help to straighten them out a little bit and get them realigned. And then we add a little bit more intense exercise or a little bit more force going through those muscles. And when that happens, they get stronger. And this progresses over time. It's not all at once. So that when I let her run off leash again with Reggie, she doesn't pull up lame. So that's scenario one. Scenario two is, let's say the x-rays were done and they saw a lot of swelling in the knee and decided that it was probably a cruciate injury, which it was for Sam. So cruciate injuries, what that means is it's a ligament. So again, if a ligament attaches bone to bone, and it's in something called a joint capsule, and there's not great blood flow into that area. And those ligaments around your dog's knee, they help to stabilize the knee so that there's not too much movement in the knee. So when they have a small tear in that ligament, that force that's going through the knee constantly every time they push off the ground, then that puts more strain on that ligament. Plus, there's not great blood flow in there, and the knee isn't super stable. And it's painful. And then that pain causes the muscle not to fire with the same amount of force of contraction. Then you have this whole sort of negative cycle of things that are going on, and it doesn't get any better. Left to its own means, without any external stability, without surgery, which we'll talk about in a minute, that knee gets what's called fibrotic. So the body creates extra bone, extra tissue, things get thick, the knee gets big, and that's how it stabilizes itself. So that's not really what I'm looking for either. So those are two scenarios why just rest and anti-inflammatories might not be working for you. The long and short of it is movement is medicine. You just need to know the right amount of load, and managing pain is absolutely necessary. There are multiple ways to manage pain. Sometimes pharmaceuticals are necessary. Sometimes there's something else, but we're going to talk about that in a minute, because I mentioned maybe she needs surgery, and surgery is our option 2 for injury recovery, or our category 2. Surgery might be absolutely necessary, and there might also be other options. Let's switch gears for a second, and let's say we have a little dachshund that hurts his back. And maybe you've gone through this experience with your dog where they are seeming like their head is getting a little bit low, their back gets a little bit rounded, and you start to notice they're wobbly on their back end. And then all of a sudden, they can't get up with their back end. So, of course, you're panicking, taking them to the vet. Unfortunately, these little guys are prone to a type of back injury where they can herniate discs in their back, a type of intervertebral disc disease. And often surgery is recommended, and it has to be fast. Or at least that's what you're told. And it's expensive. I had a client once that said that she made the decision to get her dog back surgery and spend $13,000 at the superstore parking lot, a grocery store parking lot, in the middle of a snowstorm, because that's when it happened. Sometimes surgery is necessary. Sometimes there are alternatives. Sadly, often the alternative that many people are given is euthanasia. But there is a third option, which we're going to talk about in a minute. But back to this back injury for a moment. Earlier this year, I held a summit called Navigating DM and Canine Disc Disease, and I brought in a gentleman named Dr. Paul Freeman. He's from the University of Cambridge in the UK, and he's a veterinary neurologist, and did this big study on these little dogs and these back injuries, these disc herniations, with different levels of pain response. When a dog becomes paralyzed and they have this back injury, one of the things they're looking for is whether or not they're deep pain positive or negative. Can they feel their toes at all when you pinch them in an area that is kind of painful? Please don't go test your dog. Side note. And it has been believed for the longest time, and the practice has been that, especially for dogs that are deep pain negative, that you have to get surgery, and there's a 50% chance your dog will walk again, and that surgery needs to happen quickly. There's a window of time that you have to do it in. His study, this is so cool. This is part of the reason I'm doing this stuff, because not everybody has the means to do that type of surgery. And then you're like, what do I do? His study actually showed that a lot of these dogs, majority of these dogs, got better with conservative management, without surgery, even the ones that were deep pain negative. I will drop the link to that Navigating DM and Canine Disc Disease in the show notes for today. But imagine the possibility there and bringing that information over here. Related to this, I have a client whose dog, not one of these condrodystrophic, that's what the dogs with the short legs are called, but a husky that she herniated a disc in her back, and she was not a surgical candidate. And her pet parents eventually did find me, and she's doing quite well. She's very mobile now, even though at the time this happened, she was paralyzed in her back end. And of course, they were going through all the emotions. And one day they were coming to the clinic, and I could see them having a conversation with a woman in the parking lot. And the look on this other woman's face, I just knew what was going on. And it was heart-wrenching, because they came in and they told me that she had asked what was going on with this dog. And they said she herniated a disc in her back, but we are doing conservative management and lots of rehab, and she's doing really well. And the woman's face kind of dropped a little bit and went somewhere else. And she said, I had a dog that herniated a disc in his back. I didn't know this was an option. I euthanized him. She'll wonder forever whether or not she made the right decision. So if we can together, again, raise the awareness of what your options are and help people, gather that information, imagine that place, imagine what's possible, what your dog can do, what you can do. Her alternative was euthanasia, which is option 3. And sadly, sometimes it is necessary. I'm not saying it's not. But often when you're given an alternative surgery or euthanasia, your dog's never going to walk again. Or even if the dog doesn't walk again. Sam didn't walk for the latter part of her life. But I used to run after her down the beach in her wheelchair. And she went to the dog park, and she was bossy, and she had a good life. It doesn't mean they can't live a good life. It's just the person giving you the information doesn't have the knowledge or the resources. So your alternatives become surgery or euthanasia. But what if there was one more option? Canine rehab. So conservative management with canine rehab. And a little bit about what canine rehab is. Obviously, I have a little bit of a bias, but there's a reason. And again, this educational component of it is a big part of what I do as a physiotherapist trained in this field. But we, as a profession, we're veterinarians, vet techs, physical therapists, physiotherapists. We have credentials. Let's start with that. Something I learned through my online community that was a little bit disturbing, to say the very least, was the number of people that thought they were getting canine rehab, only they weren't checking out these credentials of the people that were providing their services, and they really weren't rehab therapists. I have a diploma in canine rehab from the Canadian Physiotherapy Association, from our animal rehab division. There's the Canine Rehab Institute, there's the University of Tennessee. Point being, we have credentials. I'll drop them in the show notes so you can double check. You should ask. Don't ever be afraid to ask. You want to get what you're paying for to get your dog the best help. We apply a lot of what you do in physiotherapy or physical therapy to the canine client. So we evaluate how the dog moves. We work collaboratively with veterinarians, acupuncturists, massage therapists, all of these people. But we evaluate how your dog moves, their neurologic status, how they feel, what their posture is like, what their function is like. We might do special testing. And we come up with this picture of what's going on with your dog, the pathofunctional diagnosis. And then we put together a treatment plan and work with you and teach you what to do to help your dog. And then you go through and you take things home and you do them at home. And whenever you come in, maybe not every time, but frequently, your dog is reevaluated. This was the other thing I learned from my online community that was shocking was people were like, I don't really do physio, not really into it. I took my dog to hydrotherapy for 6 months and it didn't do anything. I was like, what else did you do? Laser. How often was your dog reevaluated? Did you have anything to do at home? They weren't reevaluated. And maybe they were just given range of motion to do at home or something like that. Okay. That is not at canine rehab. You have to reevaluate. And I'm telling you this because I want for those of you that are listening that are doing this with your dog, make sure your dog is getting reevaluations on a regular basis and that their treatment plan is being adapted for that based off of that reevaluation. And then you are getting things to do at home, and those things should be changing and getting harder. And then it also tells you if you're on the wrong track and need other diagnostics, other interventions, it gives you that information. So that reevaluation, that is really important. That is so important. Okay, so that's my tangent on there. Which one of these options is the best option for you? Generally, it's a mix, other than euthanasia. We'll just take that one out. But multimodal, you're going to have a mix of these things. You may or may not need surgery, but you might need some form of pain management and then canine rehab. Along the way, we might help you with mobility supports. And like I said, working collaboratively with others as well. So hopefully that was helpful. That just touched a little bit of the surface of what this podcast is going to cover. Sometimes I'm going to be here solo, like I was today. And sometimes I'm going to be here with a guest from somewhere around the world to talk to us about anything related to canine mobility and living with dogs with disabilities. Because sometimes, like in Sammy's case, your dog's not going to get better, but there's still lots that you can do to help your dog. If you have questions or want to see a certain topic covered, let me know in the comments. This podcast is designed for the pet parent, and I want to be able to pull topics that are going to be helpful to you. So I will definitely be checking those out. I'll be sharing every week. Don't forget to subscribe so that you get notified whenever there is a new episode released. That's a wrap. Thank you so much for listening. It means the world to me. And until next time, remember that you can help your dog move better and feel better. We'll see you next week. One more thing. This podcast is meant to be educational, to hopefully entertain you a little bit and help you feel empowered to help your dog and advocate for your dog. It is not intended in any way to replace any medical advice that you're given by your veterinarian, your rehab therapist, or another qualified professional. Got it? Good. We'll see you next week.